So good morning, everybody. It's my pleasure to introduce our guest today, Brent Kalinowski. Brent is a community safety and well-being planner, not just for the city of North Bay. He's actually the founder of what I remember being called the Hub, and it started in Prince Albert, right?
That's right.
And that was a few years ago, eh, Brent?
Yeah, 2000 and
you actually did a presentation at Calvin for us.
I did, yeah, for the same group and for you. It's one of the first ones I did. That was back in 2013, so 10 years ago.
And Brent is he has lots of experience in community safety, and he's, as I said, he is the founder of his own. He has his own practice, guiding and supporting and growing a number of adopting community safety well-being models across Canada and the United States. So I'm really pleased that he decided to come back to North Bay, and during COVID too, right?
I was here.
And now he is working for the municipality and bringing some really unique and progressive ideas to our community for community safety and well-being. So let's welcome Brent.
Thank you.
You're on.
All right, I'm just going to figure out the technology here.
Sure.
How long do I have?
You have till 10.
Oh, we have lots of time then. Okay.
Yeah, and if you can, and I'm sure there's going to be lots of questions because our group's very curious.
Good. Can you all see that? The plan? Yeah. Okay. Awesome. Things are starting well. Well, thank you for that introduction, Harriet, and the invitation to speak to you all. It's something that I'm very passionate about, and as Harriet described, I've been doing this for a number of years now. From my experiences as a police officer, I was a police officer out west in Prince Albert, Saskatchewan. Retired there after 27 years, 5 months, and 22 days. But who's counting? Wow. But you know, it was that frustration of not being able to fix a lot of things, and was looking towards the end. But all that led to better conversations about how we as a police service could be better involved, and that included getting partners. So that's how I got into this space. It's evolved. I'll go into that a little bit more, but have been in North Bay since 2013. Although I did work here a couple of years, and then my work took me right across Canada and the United States. I did stay here in North Bay, so our home has been there on fodder since 2013, and the opportunity arose to come back to work here in North Bay in April of this year. So I was very happy to be able to jump at that opportunity and start to apply some of the things that I've learned along the way over the last 10, 12 years, and now I can apply them in my home community. So I'm going to tell you a little bit about that. It's all centered around the community safety and well-being plan that municipalities are now mandated to not only create, but execute as well. So just to give you a little bit of history on that and the why, really, it all did start back in around 2010 or 11 when I was still in policing at the time. We're trying to figure out how can we make that difference that we were all trying. Despite our best efforts, things were still happening, crime rates going up, and we just didn't seem to be fixing anything. But coming to the realization that we couldn't arrest our way out of the issues. So if we weren't going to do that, we needed partners. So we did gather our community partners at the time, and it was everybody, schools, addiction counselors, mental health counselors, hospitals, everybody, and said, we understand when there's risk, but we can't do anything about it. So if we can identify it, can we get some of our partners together to mitigate the risks? And lo and behold, we started doing that, and it worked almost immediately. People were pulled back from risk. We immediately saw reductions in our crime severity, our crime responses, our calls for service immediately started to drop, and a lot. So that led to the province becoming involved in Saskatchewan. I started to work for the province of Saskatchewan in expanding those types of risk-driven and collaborative efforts throughout Saskatchewan. And when you start doing something good, especially in policing circles, everybody's looking over the fence, and then they're coming over to say, well, if you're doing it, it's working, how can we do this in our agency? So that was happening right across Canada, and Ontario was no exception. Toronto, North Bay, Sudbury came to visit us and saw what we were doing and took that information back to Ontario and formed the Ontario Working Group in 2012. They started creating situation tables, as they are now called, in Ontario. That led me to coming to North Bay, Ontario in 2013. I retired and came to North Bay and helped lead the North Bay Gateway Hub table in its inception and for those 2 years. Following that, I stayed in North Bay, but I continued to do this work right across Canada. But what we were finding were the tables were working really well. So you had groups of caregivers sitting around the table every week talking about situations of acute risk, who needed to be involved, and following the meeting, they would go out and knock on the door, literally, offer services for support, maintain contact with people who were at risk, and reduce that risk and made those connections. But what was missing was the leadership component. It wasn't translating from the people that were doing it at the front lines to leadership in each of the organizations. The situation tables, in a sense, were that shiny, nice thing that everybody wanted, but there was no connection. So when we had conversations, we were connected to most of the ministries across Canada and different provinces. And when we had that conversation with the Ontario ministry about that missing leadership piece, they got it. And at the time, the Police Act was open, so they saw an opportunity. And lo and behold, 18 months later, which my understanding is quite a record, they created legislation that did tie those two pieces together of risk-driven collaboratives and community initiatives. So they mandated, in the Safer Ontario Act, they mandated municipalities throughout Ontario to not only create a plan, but be collaborative in the execution of the plan. So that happened in 2019 when that was passed. We started here in North Bay doing that research, the consultations and the surveys in 2020, right in the middle of the pandemic, and took a year to do that. And then 2021, it was approved by council. I was hired in April of 2022, and we started implementing the plan going forward. So what does the plan look like? There are 4 priorities, 15 or 16 strategies, and 53 different actions. But as you can see, the priorities are service network, addictions, homelessness, and mental health. And they're really the usual suspects in our region up here in Ontario. Those priorities are quite consistent. So from the service network standpoint, what can we do to make an efficient and coordinated system? And how can we enhance delivery? We have a number of passionate people, but a number of committees and tables throughout our community here in North Bay, in the area of 75 to 85 different tables. Some of them are doing the same thing. Some aren't connected, some are. So how can we start to just make that a little more efficient? That's kind of the theme of the service network, making that more cohesive. Addictions, homelessness, mental health, a number of our vulnerable experience all 3 of those pockets, and often that's what accumulates and contributes to homelessness. So how can we advance addiction treatment? How can we enhance harm reduction? How can we enhance access to mental health? How can we increase even that primary care? And I should preface this by saying we're not alone here in North Bay with these issues as it relates to homelessness specifically, or even mental health. This is a national problem. A lot of our communities are experiencing the same thing, and certainly not as an excuse that, well, everybody else is, so it's okay that we are. It's just a problem that nobody has really found the magic sequence to solve a lot of these things yet, but we're trying. And then of course, homelessness. We do have to increase our transitional housing, affordable housing. I tell the story, not only there's a number of our vulnerable and unhoused that can't find the simplest of accommodations. That is certainly prevalent, that contributes to homelessness. But even at the middle end, or people just entering the workforce, or I've told the story before, my daughter came to visit for the first time last summer with my grandson. She's a single mom, fully employed, but she couldn't afford to live here. So how can we create that space for that population and below to create a better continuum of housing care? And of course, then expanding coordination of our outreach services that are out there. There's a number of agencies that do that, but how can we coordinate that better? I'll be honest with you all, that primarily all of those outreach services work 8 to 4. We know our problems exist outside of that. So how can we change that? So this is just a graph. You can see that the red, same slide, but the red as a bar, so to speak, of progress in each of those categories. There has been movement in all of those situations and all of those strategies. And of course, some of them take more time than others. But just to demonstrate that things are starting to move along and our collaborative is aware of them. So really, what are we trying to accomplish with the community safety well-being plan? Well, primarily and broadly, it's a reduction in harm and victimization for everybody in the community. That's the broad speak. And then a decrease in upward trends and demand for costs of incident emergent responses. Because primarily over time, that's how we dealt with emergencies. Until somebody actually called that they were either hurt, they're being victimized, there was no response. That said, we respond really well. We have police services that are great. We have health systems that are very good, but something's already happened. So how can we decrease that and start going further upstream and identifying things before they happen? So in that, how can we identify our risk factors and then prioritize them and address them, as I said, before they escalate? And then looking at our risk to community safety and our priorities in all of them, in mental health, addiction, homelessness, and housing are addressed upstream. And then all those community resources relevant to that are coordinated and aligned at the earliest state of event intervention. So if you can catch that theme, it's upstream sooner than later. A lot of this stuff is very predictable. And if it's predictable, it's preventable. So if we have the data, if we understand where people are in relation to risk, if we can support and connect and mitigate those risks, we know just from our data and our experience that we can remove some of these harmful outcomes. So my role here at the City of North Bay now is the Community Safety Wellbeing Coordinator and Strategist. And my actual job description, if you will, really is fluid. I don't have any authority over any of our partners or any of our community agencies. I don't have authority over how the hospital does their business or how a community counseling center provides their services. But what I am tasked with and what my role is to foster, facilitate, and coordinate our plan that we have, try to make it it's not a city plan, it's a community plan. So conversations to reflect how that reflects in each of our agencies and how everybody can contribute to that. And then, of course, it comes to the execution. I'm there to guide and support with the experiences that I have, and then report back not only to our Community Safety Wellbeing Advisory Group, but to the community as well. And I'll talk a little bit more about that. So really, what's guiding us to get there in order to decrease some of those things that are really rising or increase things like health, access, or housing, just well-being in general? It has to be strength-based, risk-focused, and risk-focused is very important because we do know that if we can identify what the risks are and mitigate them sooner than later, then we're going to be much further ahead. What I do want to highlight in these principles, because they're all a lot similar to others, including evidence and evaluation and effective partnerships, but highest level commitment. And when I talked about that missing piece from the good work that was being done at the front lines with people getting together, talking about situations of acutely elevated risk, they're able to go out that day and do that. But then that bumps into, do they have the time to do it? Does their agency or their boss or director give them that time to do that? So it creates a shift in operation and service delivery. So in order to advance that, in order then to see what the systemic issues are and then start to address them, you need that highest level commitment. Frontline people can't do that. So thanks to the strength of the mandated legislation, we're able to put together a Community Safety Wellbeing Advisory Group, which is mandated within the legislation. So this is our list here in North Bay. You'll see that all 4 school boards are involved. Our Indigenous population is involved. HANDS, community counseling, the police service, really everybody and anybody who is needed to start to address, and not only start to address, but are also funded in this realm of community safety and well-being. It also includes my director here at Community Services, Ian Kilgore, and just recently we've invited, and she's accepted, Justine Mala, who is the council member and the chair of our Community Services Committee, to be involved, to be able to be within the tent and not necessarily call shots, because it's not our plan, it's a community plan, but to be able to also see and hear the conversations, the struggles, the frustrations, and really how complicated some of these relationships can be. So from a municipal perspective, what can we do? What levers do we have to pull? And when it comes to housing, addictions, service coordination, mental health, we don't have a lot. But what we do have is the well-being side of things. And that's before the meeting started, that's what Harriet and I were talking about, is things have really changed here at the municipality, and understanding what our space is. It's not just sewers, roads, taxes, and things like that. It's recognition of the services that we do provide and how that impacts the community. So accessibility, inclusivity, our public transit system, it ranks right up there with other safe spaces. What really attracted me to the community when I moved here many years ago were our bike paths, walking trails, our community gardens, our waterfront, things like that not only attract people, but I can go there, you can go there, and we can all appreciate the space and get a better sense of well-being. The municipality works with the YMCA and supports that financially. Our building incentives and property standards is a new is a new opportunity for us to be involved in our housing situation. How can we advance that quicker? So there's some other things in the chute that I can't talk about today, but they'll be released in the next couple of weeks on more efficient ways that people can develop not only their properties, maybe advance their home structures, building apartments, to make a lot of those things quicker, and maybe tax incentives as an idea for certain larger projects is a way that we can contribute to advance the housing portion. CSWB principles, or crime prevention through environmental design. I have an example of that further on in the slide, but how can we help spaces with lighting, cleaner sight lines, because we do know if those spaces look better, if they're not really ratty things welcome ratty behavior. I'll be totally honest with you. It's the broken window theory, or part of it. So how can we advance those principles? And we are. And right down to economic development events. I mentioned our waterfront, and primarily the community safety well-being plan. The city embraced it when it came. DSAB did the plan for us, but it's not just sitting up on a shelf up here. They realized that it needed to be pushed forward. Someone needed to lead that. So took the leadership role and created my position, which didn't exist before, in order to advance these priorities. So one of the things as well that I do is a community liaison for community complaints, business complaints, and I welcome that. It gives me an opportunity to understand what's happening in the community from a community member perspective, as well as if there's opportunities to change something. So an example of that, and it relates to CSWB principles, as well as the pedestrian tunnel at Fraser, which looked like that for a number of years, number of complaints. I do know there were a number of police interactions in that over the years. And as you can see from that picture, it's not a very welcoming space. And unfortunately, when it's not welcoming, it's not well used, and then it just attracts other things. So it became the subject of a lot of complaints. I received a number of them, and I went to my resources here at the city to try and understand why it looked that way and what we can do to repair that. Well, it was complicated by the fact that the Crisis Center of North Bay owns the majority of it right in the middle. The city of North Bay owns the front part, and a private citizen owned the property on the back. So you have three people involved. It was hard to get everybody together. When I got my group together here at the city and explained, this is kind of our role in space and community safety and well-being, we could do this. We can't do mental health, can't do addictions, but we can do this. So after 17 and a half minutes, It was decided in the meeting, we were going out and fixing it. Paint it, better lighting, clean it. In the middle, there were some boulders that prevented not only traffic, but some of the sight lines were obscured. So the lawns and the shrubbery was cut down. Those boulders were taken out. And as you can see, just with those simple things, makes it a much more welcoming space, and a space intended for what it was intended for and now is used for. There's going to be more lights coming in, as well as some murals that are going to be painted in the springtime. So other additions in the plan, I showed you those red graphs, are just kind of how some of these things are moving along. Some of the things that were the downtown community ambassador program that was initiated. Low barrier shelter, Northern Pines transitional housing has been in play and in motion for the last year. We're still advancing that. The Indigenous Friendship Center is set to open. There's Suswin House transitional housing. Coordinated access and Build for Zero is a combination of two things that culminates into Build for Zero, which is our North Bay commitment to end homelessness by 2025. That's a collaborative of a bunch of different agencies, including some community members, moving forward to identify, so through coordinated access, who needs housing, what type of housing do they need, what is our housing, and it's a system built in place to start to slowly get people housed and understand who they are, what they need, and then in turn, what do we need as for, or what are we short of if we are for housing in the community. You may be familiar with Medicine Hat, Alberta. They were in the news the last couple of years as accomplishing that. They did get to zero homelessness for a period of 3 months, and they're still hovering just above that, but they're much more down the path than we are. That was 8 years of work and collaboration in that regard. So we are also working on that, and about 3 months in. Our police mobile crisis has expanded their mobile crisis services. They had a nurse and a policeman that were attending mental health calls. We now have 2 nurses and 2 policemen that do that, and they're working 6 days a week, peak hours. But we are also looking at reviewing that. And how can we expand that to attend to other calls, so other non-police calls? We do know that 70 to 80% of police-related calls are not criminal. There are other situations. They could be loud parties, they could be disturbances, they could be intoxicated people, all of those things. So how can we expand that to have a different response in order to deal with that? That's not only more efficient, but it meets the need of the situation. We're also working on addiction treatment on demand. I have a meeting later today about that. I've collected some of our human service providers in order to address Bob or Sally that says, you know what, today's the day. I'm ready. I do want to go into treatment. We do know that it's horses and water, but when people are ready, we have to be ready. So how can we mitigate the length of time that waits? Because the window for somebody wanting to address their sobriety is quite small. So if we can direct that sooner, we'll be able to help them along their path. So we've, in our pilot phase, we've dealt with 4 different individuals who are still in treatment. One is just about through treatment, to be able to get them in quicker and move it along when they're ready. But that takes a lot of work in the background and changing sometimes the way we do business as a community collaborative. I mentioned our community safety advisory group. We are formed and also reviewing the plan to see if there's more things that we need to do. The plan was done back in 2020. A lot has happened since then, not to mention a pandemic and all the results after that. So there are some additions. I'll talk about a couple of them just in a moment. Alignment of our community tables. I mentioned earlier that I'm seeing now things are slowly starting to come together, and that's one of them. We're starting to see our community tables starting to get aligned with not only what our community safety well-being plan is, but start to work towards those 4 priorities instead of scattering around and working on this and working on that when we're really not that well organized. So it's getting better. And our violent threat risk assessment in schools, having a coordinated and fulsome response to situations in schools, not only the emergent ones, but how can school teachers and school officials identify risk sooner than later? And more often than not, there's signs and signals and breadcrumbs along the way before that violence happens or that situation happens. We've had a lot of that in the media lately with some of our schools, and I can tell you from history and the trajectory, it's only going to increase with everything else we've been dealing with. So having a system in place, we're looking at how we can get that training accomplished. It's right across Canada, this particular model, and the United States, and we're looking for the fall for that, but that collaborative has also been built. Another little collaboration I wanted to mention to you that really isn't, in the large scheme of things, wasn't that complicated. We do know that we have a homelessness problem. We have a lot of people living on the street that are unserved, unhoused, and they have a lot of needs. We also know that we have an emergency room that is also overrun. I happened to be in there on Monday. There was about 40 to 50 people waiting in the waiting room, hours long waits, up to 10, 12 hours I've heard stories of. How can we fix that? Well, we do know that a lot of the population that goes there can be addressed within the community. Good example is the AIDS Committee of North Bay has been dealing with a lot of the housing of the vulnerable, kind of become the de facto center for some of those folks to go for some of their needs and some of their medical needs. They have a nurse practitioner and an RN that work there, very busy every day. And a lot of the work that they're doing would have resulted in an emergency room visit, because the people they're serving, the only other place they can go is the emergency room. So they're dealing with wounds, they're dealing with frostbite, they're dealing with prescriptions and all of those things, to the tune of about 100, anywhere from 100 to 140 emergency room visits avoided through their good work. I came to learn that in a lot of that work they were doing, they were using shoestrings, popsicle sticks, a little cotton, like whatever they could find, because they're a community-based organization. So I was able to bridge a relationship and a memorandum, MOU with the North Bay Regional Health Authority and the hospital, and got them to understand you have a community agency that's saving anywhere from 100 to 140 emergency room visits a month. Can you help them out with some supplies? Didn't take very long. The CAO came down. We delivered some supplies to the AIDS Committee in North Bay, and then some, and committed to do that if and when needed. They just have to place the order, and they're able to do that work, saving a lot of the work on the back end. They're doing it at the front end. So that was a really nice little collaboration. The other thing I wanted to talk about when I said we were reviewing the system or the plan and what wasn't in there, and one of the things that wasn't in there, in addition to some youth things, was the prevention aspect and further upstream. So if you're not familiar with adverse childhood experiences, it's all based in trauma, childhood trauma, and anywhere studies have shown us that about 61% of our population has at least one of these ACEs. And that you can see around there, it's emotional abuse, household substance abuse, a lot of different things. But 1 in 6 in the population has 4 or more. And that's very significant, because that does relate to our health and our well-being. And we haven't really been focusing on that for a lot of years. We're just dealing with people's trauma or their situations as it unfolds in the emergency room, out in the street, as a police complaint, as an unhoused situation or an addiction situation. We're just responding to it. So part of the work with our community safety well-being plan and all of our partners is how can we integrate an adverse childhood experiences model community-wide that would include schools, other institutions, other services, to start to do some prevention in addition to reacting to what we have now as trauma-informed treatment. And understanding that's what brings somebody from what seemingly was a very innocent life to now being homeless, addicted, with mental health issues, or just problems at work or with wellness. So that is in the chute as well. You may have heard, and I believe that it's tomorrow morning. There's a community presentation for the Icelandic prevention model. It's a whole of community collaboration. It's evidence-based approach, and it's been successfully reduced substance use and improving youth well-being. That contributes to a lot of our VITRA type calls that we have been getting within the schools the last several months. You've seen some of those in the paper with weapons being brought to school. I've talked to a lot of students and teachers. There's a lot of youth and children going to schools with a knife because they don't feel safe. So how can we advance a whole of community model that's focused on youth for supports, bringing together community to address any of the risk factors and then promote the protective factors in youth environments. So very interested to learn how that's going to go tomorrow. We have some people from Iceland actually attending to talk about the model, what it looks like, and how we can start advancing that here in the community. So that was a very brief, kind of a lot at you in a very short time, but if you do want to look at the plan as a whole, you can find that on our website, northbay.ca, under our community, and then the community safety and well-being plan. And the plan is just at the bottom of the screen, and you can look through that. It's a large document that shows all the research and the efforts that went into creating the plan, but the plan in of itself, I believe, is around 25 or 20, page 26. And there's 4 pages that detail not only the priorities, but the specific actions that were suggested and that we're starting to act on now. So that is our community safety well-being plan. I really appreciate the opportunity to let you know what we're not only doing here at the city. I'm kind of the spokesperson in some way, but it is a community plan. Many of those agencies that I listed as that are part of our community safety well-being advisory group are involved and doing very good work. And the process now is just aligning a lot of that work and getting it together and fitting together for the future. So when you talk about, VITRA in schools, the Icelandic model looking at youth, one is for risk right now. The other is how can we advance some of these things in the future to prevent a lot of that stuff in the future. So a lot of these situations are coming together. Be very happy to take some of the questions if you had any.
I'll ask you to stop sharing your screen and we can open to the gallery. Brent, I don't know about anyone else, but I am so encouraged and so hopeful that this is happening. And I would like permission when the recording is done to share that publicly on our website, on our Facebook page, because I think the whole community needs to be aware of this, that it's getting that word out, eh? Yeah. And the second thing I wanted to mention, this is just a comment, but my daughter, Sherry Madigan, she's a clinical psychologist at University of Calgary. She does training for trainers for ACE.
Oh, nice.
ACE program. And actually I had an opportunity to witness her doing that presentation in Sudbury to a lot of caregivers in the community. It was really great.
Yeah,
so
that's
a great program. And I think Iceland is was part of that conversation too, and what they're doing. They're very progressive.
Very progressive.
Yeah.
And it's 2 ends of the spectrum, right? I mean, it's on the prevention side, and then we have the reaction side. So we do have to start thinking about, and let's be honest, like the Icelandic model or even ACEs, a lot of that work is generational, but we have to start it now in order to start advancing some of these things. We can just imagine, it's like karate. I've always wanted to take karate, but every time I thought about it, I thought how low I was on the progress. But if I had started that 10 years ago, I'd be a black belt, right? We have to start it today. So that's the movement we're having. So appreciate that.
You got to start somewhere.
Yes.
Start somewhere. Yeah. Debbie, go ahead.
Okay, sorry about that. Yeah, you're absolutely right, Harriet. Very, very impactful and very encouraging. Thank you, Brent. I learned so much today that I wasn't aware of. And it is encouraging. I was trying to read the list of agencies and partners that was on the screen there, and I ran out of time. I was reading too slowly. But I'm not sure whether I saw anyone on that list that would represent new home building, like home construction agencies or whatever.
Developers, Debbie?
Yeah, developers, or even just, construction in the construction industry, because the example you gave of your daughter who would not be able to afford to live here in North Bay, that's stunning. And yes, we all know that we need low-income housing, but what about the medium income, people like your daughter? Because there's a lot of people who, I'll be perfectly blunt and honest here. a lot of the low income housing that gets created, a lot of people don't want to live there. And I think we all understand that. And I'm just saying what we all believe to be true. So people like your daughter, people who are employed but can't afford the rents here in North Bay, is there anything that can be done to bring on board the developers or, you know, something like that?
Yeah, thanks for that question. And who else am I talking to here? Your friend.
Oh, this is Willow, and she's
Willow.
just, yeah, I'm babysitting Willow for a couple of weeks. So, and she's just my best little buddy. I don't know, the owner may not get her back.
Well, she looks like a pleasure to be sure. I'm a dog guy myself, so thanks for that. Hi, Willow. No, we don't have anybody like that on our advisory group. That being said, though, we do have DSAB, who's responsible for our social housing and our housing, and between them and my city rep, who also has planning and development in his portfolio, once we can develop that opportunity, there can and will be a subgroup then. So once we understand what our housing needs are, there's a needs assessment that is almost completed, then we can take that to the next level and then talk about how can we include developers or building people to see how we can initiate that. Some of those developers are involved in the Built for Zero project. So it's starting to, from both ends, right? It's coming, but as soon as we can start to have some information and realize what we need and where we need it, then they'll absolutely be brought into the fold. So thank you for that.
I'm glad to hear that, because it makes a difference as to who we attract to North Bay, who can live here, you know, with a decent quality of life. There's also, and I'll say it, there's also a real need for appropriate housing for seniors who, you know, need to downsize or get into a bungalow, something with a smaller yard, that kind of thing. It seems like the only housing developments that are going on now are monster homes that only a very select few can afford.
100%.
Is there any thought to, I've been thinking about this, you know, there's a lot of, is there any thought to some of the vacant properties in the municipality? You know, I'm thinking on Fisher and the corner of McIntyre and Fisher, the old, what was it called? The old hotel there. I remember going to a party there once.
Is that the old Sands?
The Sands.
The Sands. Like, I thought, how long is that property going to stay like that?
Well, it's sold, I believe.
Oh, it is, eh? Okay.
Yeah, it sat like that for a number of years, and then once they finally, you know, clean it up, because wow, what an eyesore in part of the central part of the city. But then they in the summertime, the actual owner came and cleaned it all up, and I thought, wow, that's really finally that you are. But then the for sale sign went up right away, so it was because of for that. But I believe it has sold. I don't know who's buying it or what, but it's a primary location, so I have no idea what's going to go there. But as far as any of the other properties, we are looking at what some of the undeveloped properties are and how we can utilize those to the best of our ability as well.
I see a question here. What about the Civic Hospital site? Anything happening there? Is that going to be residential, or do you know?
I don't know. Don't know about that.
Okay, it's probably, I think it's privately owned. I'm pretty sure, by a corporation. And there are a lot of corporations outside of our community that own property here, right? So it's a big task and complex, I'm sure.
It is. It is.
But I think it's so, to not have a place to rest your head or to make a meal or invite a friend in, you know.
Yeah.
I think that has a lot to do with belonging.
Absolutely.
And I mean, I don't think it, I know that it does. And I think that would be, I know you've got, what you're doing is, I hope you recognize that we actually think that this is just fantastic that you are on board with the city doing this kind of work. because it's so desperately needed. Bonnie, go ahead.
I just want to thank you very much for your presentation. We certainly learned a lot. And I want to piggyback a little bit on what Debbie said. I have talked to the Mattawa Conservation Authority, and I've talked to 2 different councillors, and everybody says they don't have any control over the private lands. People can build what they want. Is there any way that you, as a planner, a city in planning, could make some of those properties that they have to have so much of a green space for the number of houses they build, that they have to build maybe a semi within or a 1,200 square foot house, so that we could start having mixed families in there, so that you know, people don't, you know, they're not housed in, okay, I have to go, you know, in the city housing, which is all together in a little spot. Like, is there anything that you can do on that? And the other one thing I wanted to just ask was, I know Out Loud asked for $130,000. I was just wondering if they are getting that, because I find that they are very important for at-risk youths.
Well, thank you for both of those. On the first one, Bonnie, as far as the planning, we don't do development. But we are in the development conversation. We have a partnership with DSAB now on where we need and what we need. And once we can establish, or once we have established that, then we can figure out where that needs to be. And if that is in existing spaces, or if that is in, excuse me, that has to be in a new space or neighborhood development. And then what's that looks like. I know we are getting much more conscious on the green spaces and taking a lot of those into concepts into consideration, and had a very interesting meeting with Canador just last week on becoming more green. You know, so that's in the conversation now to even advance that part of the conversation along. So if that can come to fruition, we can start to see that changing a lot of different things in how we plan and build and then move forward. A lot of steps have to be taken yet, but a lot of those things are in consideration, absolutely. As for Out Loud, I've been there, I've met Seth, I've saw the space and see what they do. And yeah, it's a great space and something that the community needs for sure. I have no idea. I'm not on the anywhere near the lever that gets pulled, whether somebody gets funding or not. I do know that they have an outstanding request, so I don't know where that's going to go. So I can't really comment on that one way or another, other than they're doing some really nice work there. That's a space for a lot of our youth. They don't just serve the LGBTQ plus community. I think from a conversation with Seth, is about 60-40, 50-50. Of the community there, but all youth. So they need a place to hang out, and we are short on those spots. So they're doing some great work.
Yeah, seniors are short on spots too.
I'm sorry?
I just want to say seniors are short of spots too. Like, there is no affordable spots that seniors can rent to be together, or any group actually for that matter.
Yeah, and you're right. I mean, that's part of the planning or the needs assessment to know where that is. Can we create seniors neighborhoods? I know there's, you know, smaller homes that are being built in neighborhoods. There's a group called Homes for Heroes that provides plans for smaller neighborhoods relating to homeless veterans, but the same concept could be applied to either senior living or people that want to downsize in a smaller community, and then also have support or a community space within that neighborhood that the community can go to with support. So there's a lot of ideas that we're considering and throwing around, but it's on the other side of it. And talking about the development question earlier, it's to get the developers on board to be able to do that, because at the end of the day, it's all about money. Unfortunately, and some of the developers, unless they have a 15 or 20% profit margin in what they do, they're really not coming to do the project. And a lot of these smaller projects, or more needed projects, if you will, don't carry that type of profit margin, unfortunately. So it's further down the list for some of them. So we're going to have to be creative in how we activate some of these solutions if we come to them.
Anna, go ahead, please.
It seems to me that is more of an observation. Like on one side we have a need, and on the other side, it seems we have resources. I think particularly of Woodfield High School and some of the other buildings that are unoccupied that seem to sort of, they could fit together. Like what kind of a process has to happen to put one together with the other and maybe make something happen with resources that are already in place?
Yeah, that's a good question, and thanks for that. I think unfortunately, we're a little short on the resources side. But the high school exploration is in a couple of different conversations right now for different things. Unfortunately, it's not in a very big conversation about transitional housing or the homeless. You know, we have the Chippewa experiment to, you know, kind of go off of when it relates to not in my neighborhood or the situations that result that are around that at times. And I will add that it's really complicated by the low barrier shelter, not as much of the transitional housing. Once people get housed and are more stable, those things tend to just entirely disappear. They're just part of the neighborhood. But that's the feedback and the return we're getting when we're having those conversations about those places. But in addition, Northern Pines, we're still fighting. It's now a fight with the province on, we need some operational funding. They provided us with funding because we had the need to create a space for transitional housing. We did that, and we don't have the supports for it. I can tell you a lot of our agencies are struggling with retainment, attrition, or people going to other jobs. COVID opened the world of virtual up. I mean, this meeting no exception, but it's also translated into working. We now have people that have moved to North Bay from Toronto, sold their high value property there, spiked up the bid for a home here because it was still a deal for them, raised our house values up, and now they're working here, or they're here, but they're working for a company in Toronto. So the virtual part of that is removed a lot of our frontline workers that found attractiveness to do that. So we're having a shortage of frontline human service workers. I mean, you just have to go to the website for hands. There's a number, probably 12 or 15 positions they're advertising for, and having trouble finding people. So there's wage equity. There's the burnout from COVID for a lot of our frontline service providers. So the resources, yes, we can tinker with them in some of the priorities that we have to be able to work with them better, but we need more resources. It's really coming down to that. Everybody's kind of tapped out from doing 4 different things at the same time.
Yeah.
I appreciate that. Thank you, Anna.
Questions? I want to go pick up on what Bonnie said. I think Bonnie was talking about green spaces and you know, and beautification, and how important that is to developing micro communities where people, and there used to be a time in our neighborhood, I don't know if you would remember this, Brent, when the playground was where there was somebody there in the summertime and the kids were playing ball, and there was a clubhouse, you know, a clubhouse. And there are very few of those now in our parks. There are few active ones. You know, for example, on off Chappé is a very, very lively micro community, and that is a hub. There's a rink. There's everything they need there.
Yeah.
But in other areas there are passive parks that really don't. They're just passive. They're not people welcoming, really. You know. And I think that's an area that the community needs to look at, how we can develop those central meeting places where you can get out of your home and go meet your neighbors and help each other. Well, you know where I'm coming from on that one.
For sure. And I do remember I spent a lot of my misspent childhood in a local, you know, playground. Every summer you'd have new play leaders, and there was a little bit of a wading pool, and there's basketball, you painted, and and you spent the entire day there, and the weekends too, and those kind of disappeared. I did have a conversation with our rec coordinator, and the funding for that here within the city is really low. He's been really trying to increase that to start to promote that again, because I think we do have to get back to that, to the neighborhood, either the playground for youth or someplace to hang out and do some of those things with some guidance from, you know, your play leaders of sorts that get hired by the city every summer.
Is that Brian Kimber?
Yes.
May I ask? Okay.
Yeah.
Thanks. Yeah.
Thanks for asking that question or making that comment, Harriet. It's Patty here. One of my comments, and I think most of you have kind of covered it, was I was thinking about the low rental areas, and there's some areas, for instance, I don't know if it's over by Wickstead or those areas in there, you know, where there's lots and lots and lots of garbage piles up and what happens. And I was just thinking, wouldn't it be nice if there was some incentives for you? Because usually it's low income families, maybe single parents or whatever, to spend some time on their yards. And I'm just trying to brainstorm, what kind of incentives, what would it take, if it was possible, to have them not feel so defeated and maybe feel a little sense of their little village pride of some sort? I don't know how that could ever happen, and I'm not suggesting I have any solutions, but I think it's been talked about in some of the other comments that I've heard. It's difficult, and there's funding, and but it almost seems like it must feel so defeated. You must feel so awful to have to move into some of these low-income places, because it's not pretty, and it's really not very welcoming. It's kind of like a last resort, and they're off the streets, but they're living in a community that doesn't really support a lot of healthy things going on. That was just my comment.
Well, I appreciate it. And I think a lot of the work that Harriet and a couple of those groups are doing will help that along. You have to get community involved, and they're part of that community. So how do you initiate that? So I'm sure there's opportunity there with Clean Green Beautiful, or those grassroots front and center, and then getting into the community. And I think the key would be finding somebody within that community that wants to take the lead and then carry the torch with everybody else and start to build it from the inside then out. So as far as, I'll open to a lot of different ideas on incentives and how that can materialize, but it's a good observation, and I appreciate your comment.
And I think there's a lot, it's never black and white, is it? There's so many gray areas, but moving back to the way, and the way we behaved as neighbors, maybe 40 years ago, where you knew who your neighbor was, and you reached out to them, and you got to know who was in the neighborhood, who were the kids. My generation anyways, the kids didn't come in till it was time to eat. Or they went to the canoe club and spent the whole day there. There were those social connections that really were helpful. And there are some communities in North Bay that are like that. And I've had the opportunity in lower income, what you might want to say, more affordable housing. I would rather use those words. And they have within their own little, what do you call it? Compound, whatever. They have those relationships, but that doesn't happen in every space. I wouldn't say, and because there's a pride of ownership, and when you're renting, that doesn't always come through. I don't know. I don't know I don't have all the answers, but I think one is to start the conversation and to open doors. And that's what we're trying to do with Growing Resilient Neighborhoods. And we're going to be having a neighbor to neighbor streetscapes. Nominate your neighbor if they're doing something great in their yard. So Brent has offered to nominate his own place on Campbell Avenue. And I'm gonna keep him on that one. I think I know where you live now. So
I know where you live.
Can I ask a question about the downtown? I know they're redoing the road down there, but is there any plan to try and, I mean, we have such a unique downtown close to the waterfront, like it should be something that draws people down there all the time. I used to walk down there at least once a week just because I live close there and I loved it. I don't do it anymore.
So if I can ask, why don't you?
Well, there's not as many stores, number one.
Okay.
And I'm just not comfortable, you know, walking past homeless people and that sort of thing, you know, and a couple of times I've been a little nervous when someone was acting out. So, yeah, so that's it.
Okay. No, and thanks for sharing. And I appreciate that. I was uniquely and sincerely interested in why, and I have heard that before, but you're right. We have a beautiful downtown. It's no mistake why a lot of the movies are being done here, and they continue to invest in North Bay to make those shoots because of our unique downtown and other spaces. I think I saw a number last week. There was $40 million that was injected into the community as a result of those different productions. So they agree. It's a beautiful spot. The rejuvenation project has been long overdue, as you would know, to make some of those repairs and the lights to make that better. And in a unique location right by the waterfront, I think it's amazing. But to answer the other question on the downtown, the other side of it is we have a unique location in the way it looks, but it's not unique in that that's where you will find in any community you're vulnerable, the homeless, because all the resources are there. So those folks tend to exist in those spaces as well, to be close to the resources. Now, I can tell you, you know, a lot of our vulnerable or just as afraid and scared of the community as some of us are of them, and they just want to be safe. So a lot of them will. That's why you see some of them in some of the doorways, because they know there's cameras, so they're trying to protect themselves. But going forward in the future, we don't have a community center of sorts or a starting housing continuum for the unhoused and the vulnerable. I mentioned earlier, the AIDS committee kind of took that on. People are coming and going there, but we don't have a spot that's open, that has wraparound services, that we can start to connect any one of our number of people to the right resources as soon as they get in the door. You know, obviously there has to be a little bit of a feel out period, but it shouldn't just be a place for, Steve to come in and just hang out every single day. Do you want to do something? How can we connect you? And those things have been quite successful. Timmins runs a really good one. So it's in the minds of everybody here and in our collaborative too. How can we get that space as well? So those folks that are hanging around downtown, like you say, have a place to go, just like we want a place to go. So they can have that space as well. Have mailboxes there. A lot of our people can't even get ID because stuff has to get mailed. They don't have an address. So then that's an immediate barrier that just holds them in that spot in perpetuity until that first step can be taken.
But from the outside, could we as North Bay not be like encouraging more outdoor coffee spots, like people to go down and lounge, to have some little pop-up stores with the road closed, something that's going to draw people down there because it is so beautiful.
Yeah, you're right. And I do know, I don't know the exact wording of it, but I do know they opened up, what was that place a number of years ago? It was an Italian place on right here on Wild that kind of initiated
Little Italy, or Tiny Italy.
That's
Italy.
Right. Initiated that front door space. Moose has got in. I know one of the other restaurants does. We're trying to promote that because that's fantastic. Anytime I ever visited a city that had that in their downtown area, it was nice to be down there and do that sort of thing. So it's going to be difficult over the next couple of years because the downtown is going to be in a state of construction for a good 18 months, 2 years. So, but absolutely, that there's different things that could be done there. And I think that'll be part of the plan once that construction is finished, and then really take advantage of that different space.
Well, if it's going to be that long, is the city going to support some of the businesses that are down there, like a relief on taxes or something?
Yeah, I don't know exactly what that looks like, Bonnie, but I do know there's been conversations for the last couple of years that this is coming, this is what it's going to look like, how can we help, and there's people on it, because we understand that there'll still be access, but it won't be, you know, the drive-through in some spots because of the construction. It's just one of those, how do you get around it? And I know it's been delayed once or twice already for those reasons, but then, you know, the state of the road is just at a point where it needs to be done. I think we'll be much happier on the other side of it, but it'll be trying, to be sure, for the next little while.
I'm sure there are architectural drawings on what that might look like. So I'm going to have somebody on to share that with us. How about that?
Yeah, it looks really nice.
Okay, I don't know who that is. Is it Ian?
Yes.
Or
well, no, Ian, Bev.
Bev, eh? Okay,
yeah.
I'll do it, because I think we'd like to know. And we have to end because Zumba's coming up here. So I would like to ask Brent, how can we help? What would you like from us?
Well, I mean, this was fantastic to help spread some of the word, have an understanding that nobody has it, so to speak, yet, but we're definitely on it. Not only a municipality, but all of our partner agencies. Everybody's passionate about it. So help us spread that, or at least have the confidence that the work is getting done. And then share some of that through your work in the community, Harriet, with the Clean, Green, and Beautiful and growing resilient neighborhoods is, I mean, fantastic. I mean, that's that grassroots thing that needs to, you know, culminate from the bottom up as well. So be active in your community, keep doing what you're doing. And if there's, you know, anything that comes up as far as, you know, the seniors housing or just more affordable housing or neighborhoods like that, we'd be sure to, you know, include your group in consultations or to be involved that way.
That's right. Because, you know what, as I have often said, I never do anything in isolation. We're here. Yeah. And as a group, we are very committed to community. So yeah, I think it's important for us to not just ask questions, but to also contribute, you know, to accelerate action in some way. And we do it with litter pickups and other things. So I'm really, I think that we are a community onto ourselves, and we'll do what we can to help.
For sure. Yeah, and thank you all for the time and being able to let you know what this is all about. I don't see Willow on the screen anymore, but nice meeting you, Willow, too, and your group. Have fun in Zumba and just keep doing what you're doing. The community appreciates it.
Thanks so much, Brent. Thank you. Bye. I'm sharing this on Facebook, by the way.
Okay. Thank you, everybody.
All right.